Kerala High Court once asked the government why it had no money to pay social welfare pensions to the poor when it had enough money to spend for its various celebrations. Unlike Kerala's previous communist governments, this second Pinarayi Vijayan government seems to have made it a norm to splurge money on misplaced priorities and conduct loss-making events like Keraleeyam or Nava Kerala Sadas with no guarantees of monetary returns. Now, a recent report has said that the government hospitals in the state are reeling under an acute shortage of life-saving medicines. The reason is the dues that the health department owes to pharmaceutical companies. The dues have mounted to nearly rupees 500 crore. The department has to pay last year's dues of rupees 200 crore and this year's dues of over rupees 300 crore. Though the health department approached the finance department several times, the efforts went in vain as the latter cited the ongoing financial crisis in the state as the reason for the unpaid dues. The medicines for hospitals are procured through the Kerala Medical Services Corporation, which has failed to pay the companies for the supply of medicines in 3 phases. Due to this reason, many companies stalled the supply of medicines in the last stage of delivery. If the dues are not paid, the shortage of medicines will continue till March. The issue has affected the smooth functioning of primary health centers and medical colleges. Only 1/3 of the required medicines are available in the cancer treatment departments of medical college hospitals. Medicines for heart disease and stroke are also not adequate. A variety of drugs for diabetic patients including insulin, metformin and glimepiride for diabetic patients are no more available in many hospitals. There is also a shortage of various medicines including amyloid to reduce hypertension, atorvastatin for cholesterol, clopidogrel to avoid blood clotting, fluconazole to treat fungal infections, azithromycin, an antibiotic given to infected people, and pantoprazole to reduce acidity. The stoppage of drug exchanges between hospitals has also contributed to shortages. Until 2 years ago, a review meeting of government pharmacists was held at the district level every month. There, the availability of medicines in each hospital was checked and medicines were delivered from a hospital with more stock to a hospital facing a shortage. With the suspension of this meeting, the opportunity for this kind of drug exchange also vanished. After the issue appeared in some prominent newspapers, Health Minister Veena George said the director of the health department had been asked to initiate a probe if the patient encountered any difficulty despite the availability of medicines at hospital dispensary. A recent report said out of the 9 medicines prescribed by a doctor at the Thiruvananthapuram General Hospital to a patient, 6 were not available at the hospital pharmacy. The minister, however, said the pharmacy had stock of all the medicines prescribed as of Tuesday morning as per the drug distribution management system. Alternative drugs were available at the pharmacy even for those medicinal brands that were not available. If the doctors prescribe medicines outside the essential drug list, then the same may not be available in the pharmacy. That's why a direction was issued to mention the drug's chemical name as well, the minister explained. Responding to media reports on medicine shortage, Chief Minister Pinarayi Vijayan said the reports reflected the condition that prevailed during the 2011-2016 period under the UDF government. As one goes through the full report, it's clear that just 1 or 2 medicines were not there at the hospital pharmacy, he said during his speech at the venue of the last Nava Kerala meeting held at Kolancheri. How ridiculous are the minister's response? It clearly shows the mismanagement by the health department and lack of competent officials to run things smoothly. It's weird if the minister and chief minister keep on justifying the mistakes committed by a government department. Even if they want to charge some extra money for the services provided at government hospitals, let them do so, but don't inconvenience the people or endanger the lives of people.